Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Steps in the adaptation of a Steele's Trupontic for a bridge replacing the left first maxillary bicuspid tooth on a test bridge. Before we go through the stages, the technical stages of adapting the Trupontic, let's just take a quick look at the key points in developing a posterior Pontix. First of all, the need to open the proximal embrasures, to open the lingual embrasures to give better access to the underlying soft tissue, the changes which are made in the cervical third of the buccal axial surface to develop the correct length of the tooth on the buccal surface, the changes which are made in the two-thirds of the lingual axial surface to open up the proximal and lingual embrasures, deepening of the peripheral ends of the occlusal sulci to improve the spillway effect of these for the occlusal surface, the development of the correct occlusal embrasures, and then finally the development of a sanitary or a ridge-lap relation to the alveolus. And in this particular case, we will develop the ridge-lap type of adaptation. The case which we're going to do today, you can see from these models on the bench here, in which the left maxillary first bicuspid tooth is going to be replaced here in a test bridge situation. Now, just to take a look at an enlarged model of this type of Trupontic so that we can quickly run through the changes and adjustments which have to be made. First of all, we've got to adapt the thing for the correct vertical height here. Usually the Trupontic, as it comes from the supply house, is longer than is necessary. Then when that is done, we have to modify the proximal surfaces to taper in the mesial and distal proximals in order to open the proximal embrasures. And then to adjust the lingual surface here to develop the correct ridge-lap adaptation to the soft tissue. And then when that is completed, to polish all those cut surfaces and to go back then and to trim the backing here to the correct size for the particular facing that we're using, and then to wax onto that the occlusal surface which goes on here. So those, in brief resume, are the several stages that we'll go through in adapting this facing. Now, the first one of those is adapting the thing for the correct vertical length. So let's go back to the model itself here and take our facing, which we're going to use, and just put it into position on that model like that. Now, I think you can see that in its present length, this tooth is already about the same length as the teeth on either side, and we've got to trim it down on the gingival surface here so it'll seat down and allow room up here for the metal backing and the occlusal surface that has to be adapted on there. So we've got quite a lot of grinding to do on this surface here in order to get it down and adapted to the mucosa. And as we do that reduction down there, we also adapt it to the mucosal ridge there and begin to develop our ridge-lap relationship. I think you can see here that the embrasures are not sufficiently opened on the mesial and distal as we would like, and you'll certainly see the difference in the finished preparation. You can see also that this is the same length as the teeth on either side of it, and there's no room at the present time for the occlusal table on there with the gold casting on top. So our first step then is the adaptation for this vertical length. Now, in doing the test bridge situation, you want to keep this model clean and free from any contamination and so on. So it's quite a convenient thing to do, is to take an alginate impression of the master model and pour this up in a suitable stone. This is white stone. And then this model can be used during the grinding and adaptation of this facing. So this one is kept quite clean and undamaged. So the thing to do then is to take this duplicate model and to mark the alveolar area here with a lead pencil. Rub it on to get a good covering of the graphite from the pencil, and then place the Pontic in position and press it down onto that surface, and then remove it. And if you then look on the underside of the Pontic facing, See if I can just, yes, I think you can just see the marking of the pencil there where it has hit on the ridge on one side there. So that our next step now is to grind that area and then pop it back again on here and see what necessary adjustments are required. Now in doing this grinding, the Dedico grinding wheel is about the best point for grinding and cutting porcelain. Now here is the marked area which is being ground off, and then return the facing back again to the model, press it down into the desired position, remove it again, and now you'll see that we've got a marking in a somewhat different area. We've removed from there, so it's sitting there, it's hitting on this other area. So now we take our grinding point again and grind off. So, return back again to the model, seat it in position, and grind again on the marks. Now that's fine for the initial rough grinding. You can place it back by hand, but beyond the point it becomes necessary to establish some guide when the thing is returned into position, and either red utility wax or modeling clay, such as I have here, can be pushed in position and then the facing placed in there and a decision made on the desirable position for the facing. Now you have to look at it from the occlusal surface here to see that it lines up correctly along the buccal contour of the other teeth, and that's just a little bit prominent, so it wants to be sitting a little bit further back, and it wants to be nicely centered in this relation this way, and then when looked at in this direction, the embrasures on the median distal want to be about equally distributed. I think you can see there. So having decided on that sort of position, we're now going to grind this surface away so that it slowly seats down until we've got room up here for 1.5 millimeters of gold and the table up in that region. The utility wax or the molding back here enables you to pull this away and then return it back to approximately the same position again after you've ground it. It has some more pencil marks on it which I'm going to grind off. Then return it into position again. Pick up some more pencil markings and grind these again. So this is a grinding in procedure with which I think you're familiar, and I'm not going to go right through the whole procedure. We'll pick it up a little bit later on when we've completed the adaptation of the cervical part of the facing to the model. The Trupontic facing is now being ground and adapted to the mucosal tissue and corrected for vertical length. And I think as you see the model now, you can see that we've got a reasonable adaptation of the pontic to the gingival area here, and that we've got about the correct vertical length. One of the things to do at this point is to apply the opposing model and to examine the relationship occlusally between these two. And I think on a close-up here you can see the sort of thing that you've got to look at. You must have enough space there between the tips of the cusps of the mandibular teeth and the pontic facing there to allow room for the gold backing and the occlusal surface that has to be developed. And on a clinical case, of course, where this was mounted on an anatomical articulator, you would go out into lateral excursions and ensure that this same spacing existed in all extents of that excursion. We can't do that in this particular handheld situation. So we merely make sure that we've got enough room in there for the occlusal surface to be developed. And you can check this too. Again, I think if we take a close look at the pontic facing in here, the other thing to do is to examine particularly careful the sort of step down between the marginal ridge of the adjacent tooth here and the top of the porcelain pontic. In there, remember, you've got to get your connector and the gold surface between the two, the soldered joint there and on this side. And when this is against a cuspid, which is with its low lingual cusp, it's often a little difficult to get a good relationship in there. And what we will do in this case is to put a bevel actually along here and along here in order to get an extension of gold down to enlarge the area of contact with the adjacent teeth so that our connector development will be a little easier. In this situation, that is going to be necessary. I think, too, you can notice the buccal alignment of this thing so that the buccal surface is aligned with the adjacent teeth correctly. The next step is developing the proximal embrasures. And we have a chart here which I think enables me to illustrate this particular point. You'll recollect that the proximal embrasures on the distal and on the mesial of these situations are opened by tapering the proximal surfaces of the pontic itself. These are larger than natural, of course. They give good access to the tissue here for cleansing, stimulation by food flow. It doesn't spoil the aesthetics because these areas are not visible because of the buccal curvature of the tooth surface. The next step then is to grind the proximal surfaces of the pontic facings in order to open these embrasures. And this can be done with the same Delico grinding stone that we used to do the other adaptations of this facing. These stones cut quite quickly and do a very nice job without danger of fracturing or chipping the porcelain edge. And they're certainly well worth using in this situation compared with the regular green stones. Now we'll put that back on the model and see what we've achieved with that amount of grinding. Just takes a little adapting to get it back in the same relationship to what it previously was. I think if you take a close look at this now, you can see that those embrasures on the mesial and distal are somewhat more open than what they were. And that would be quite a satisfactory relationship for this particular case. I think I'm just going to turn the model around, I think, and I think you can see as you look along the buckle there that those embrasures are hidden in the normal view of this pontic, and you can open them without in any way affecting the aesthetic. But obviously that's going to be a much easier situation from the point of view of cleansing the margins of those retainers and of keeping the tissues there well stimulated and cleansed. So that then deals with the development of the proximal embrasures here. And the next step that we've got to do is to finish off the ridge-lap relationship. We've developed the labial part of that, the part that goes against the mucosa. We haven't yet taken a look at the lingual surface to see whether we've got the desirable moving away of the porcelain in that area. So now we complete the ridge-lap relationship. This means taking away our wax on the lingual surface there, placing the pontic in position and taking a look at the lingual surface. Now, if you can get a close look at this, I'll just see if I can adjust this a little more easily so that you can take a look at that lingual surface. It's not too easy to do this on the TV camera, but I think that I can probably arrange it so that it will. Now, I think if you can look into that lingual surface there, and this is what you should do when you're doing your case, look in at the lingual surface there and notice that it does clear the mucosa there, that it is rounded to some degree, but I think you can see there's still some sort of sharpish corners here and here. We're going to just grind those in order to round off this lingual part of the ridge lap, the part that does not touch the mucosa. You remember the ridge lap touches the mucosa on the buccal up to the crest of the alveolus and then sweeps away and clears that. So the next thing I'm going to do is just to round off those areas in there. Using again the same type of stone. What you have to be careful in doing this particular adaptation, of course, is its relationship to that slot running through the porcelain where the metal backing is attached. And if you grind too much away here, you can fracture the facing, so you have to bear that in mind. So the whole surface here is rendered convex in all directions and rounded off nicely with the grinding stone. Now let's take a look at it now and see what we've achieved in doing that. I think if we can close in on that, you can probably see now that we've got a better contour there in relation to the tissue. The two are more or less concentric circles. Perhaps create just a little more space on the mesial there. You can see it's a little more open on the next to the cuspid, I should say. Create a little more space on the distal. It's just a little bit closed up in there. The embrasure is not opened on the lingual as much as it should. So I'm going to go back to that spot there and just grind a little more off on the relation to the bicuspid. And we'll pop that back again and see whether we've done what we want to do. Perhaps on a close-up shot you'll be able to see now that we've got a little better relationship in that area there. Still, I think that distal embrasure can be opened up a little. Notice the curvature there is rather a marked convexity on the distal next to the bicuspid as compared with the mesial against the cuspid, where it sort of shoots further in. So I'm going to flatten off that distal surface just a little bit. Now let's take a look at that and see what we can see there. I think you can see now that the relationship there is about the same on the mesial and the distal. There we are. Let's get it in the middle of the spot. There we are. I think you can see both mesial and distal. Just a couple of little bumps down there towards the mucosa, which I'll round off in the final polishing and finishing of this situation. The initial polishing to remove the marks made by the carborundum grinding wheels is best done with a medium-grade rubber wheel, Cratex medium grit rubber wheel. And this is applied to all of the ground surfaces, and it doesn't matter if it runs over a little bit onto the unground surfaces. And these are thoroughly smoothed down. This will take out the slight roughnesses and irregularities that the coarser carborundum grinding wheel creates in here. And this takes a few minutes just to go over all of those cut surfaces and smooth them down nicely. You just dry it off from time to time and let the light shine on it. You get some idea as to the few remaining facets that may still exist, and you go over these again to eliminate them and smooth the surface down as much as possible. Now the next stages in polishing are to use silex, triple X silex on a Robinson bristle brush of this type in the handpiece, and then the final gloss and finish is put on with a cloth mop. A lead-centered cloth mop is usually used, using levigated alumina as the abrasive, which is applied in a paste form on here on the normal dental lathe. Now we're not going to do this on camera, so we'll go away and polish it then with silex and with levigated alumina on one of these, and then bring it back and let you see the polished Pontic. The porcelain Pontic has now been polished with silex and with levigated alumina, and I think you can see the fitting surface there around there has now got quite a smooth finish to it without any marked facets on it. The polished surface is never quite as glossy and shiny as the glazed surface of the normal Pontic facing, but should be quite smooth and free from any cut marks from the porcelain. So we're now ready to go ahead and adapt the metal backing to this. Adapting the metal backing can perhaps just be briefly outlined on this enlarged model. This represents our porcelain, which we've ground and adjusted, and the backing as supplied by the manufacturer is too large. So one takes a suitable scriber and marks around the porcelain like this to indicate the desirable outline. The facing is taken off, and then using crown shears, the material is cut from this side to that point there, and from this side up to the angle. Then the whole thing is turned around, and the other side is cut up to the angle, and this side here. And then the edge is finished off in a way that we'll look at more closely. There are two slight modifications that we're going to make to this particular pontic before we adapt the backing. You may remember that because of the lack of adequate space here for the connector, we talked about beveling the porcelain to carry the gold a little down in the interproximal region there. So we're going to put a bevel just along here in the region of the contact on the distal and on the mesial, so that the gold occlusal will extend down a little further in the interproximal areas and give a better relationship for contact. There's one other thing that can be done too. You remember how a Steele's flatback is finished at the cervical end to cover over the key. Well, a similar thing can be done here. And if you like to just bevel across the keyway here, you can have the gold occlusal extend down and protect that. And that can be combined in this case with the proximal bevel, so that you get a shoulder of gold coming down on the proximals and the lingual surface there. So I'm just going to grind that surface now to bevel it and make that adaptation before we adapt the metal backing to it. So that means a bevel along the proximal here in the region of the contact. Which is carried around the lingual and covers over the entrance to the keyway on the lingual surface here. And then comes around onto the mesial proximal here. Now when I've done this, I'm going to mark it in pencil so that you get a better concept of just where the bevel is. Notice it stops short about the junction of the buccal and proximal surfaces there. Now I'll take a pencil and see if I can mark this so that it shows up the extent of that bevel. I'm just running the pencil along here so that it is automatically picking up the boundaries. Now, I think perhaps you can see that in a close-up. I'll try and hold it as still as I possibly can. This is the occlusal surface here, you see, and here is our bevel coming down on the proximal. So the gold is going to overlap there from the occlusal surface. And it runs round here, and notice it dips down and covers over that keyway there, then comes up onto the other proximal along here and blends together with the occlusal there. So this gives a little shelf of gold that runs around from mesial across the lingual there and onto the other proximal there. So this is just a modification to the pontic. Now I'm going to, it isn't necessary to have this polished in the sense that the exposed surface is of porcelain now, because this is going to be covered over, but you do want to have it smooth because you're going to be waxing against this, and it'll facilitate the waxing procedures. So having cut that with a carborundum stone, which leaves a fairly rough surface, it's a good idea to go around with the Cratex medium grade rubber wheel and just smooth over those bevels on there so that they'll be easier to wax to, and that's what I've done now. That has to be done, of course, before the backing is adjusted. So now we put our backing on, and let me see if I hold this in some tweezers, perhaps it'll give you a chance to see it. Here is the backing in position on the facing, and now we're going to take our scriber and mark a point all the way around there to indicate the boundary from the porcelain and the size of backing we want. I still have to get a good grip on this to do it, and it's going to just cover it up, I'm afraid. In the areas where it's beveled, you have to make sure that the pointer you're using is fine enough to go into that bevel and to mark those situations. Now, I'll slide the backing off, and we'll see if in a close-up you can identify the scratch marks on it. I'm not sure how well they may show in this situation. Let's just see if I can get the light off it. I think you can see on one part of it there the indication of the boundary, and I think perhaps you can just see it a little there. That gives us a fairly clear definition of where we're going to cut. So now we take our crown shears, and you won't be able to follow this too closely, I don't think. We proceed to cut the gold back to those boundaries. The bend in the middle of the backing makes this rather a difficult procedure. You want a very sharp pair of crown shears that will cut right down to the very tip, and if you don't have that, you may find it not work out too well. Sometimes it's convenient just to put a little cut in this area up to that point. And if you can't do that with the tips of your crown shears, then it's a good thing to take a Joe Dandy disc and to use that just to make the little cut in at the situation of the angle of the backing. Here's a Joe Dandy disc which we'll put in our handpiece, and I'll show you the means of making that little cut in at the angle there. If your crown shears won't cut right into there, take the Joe Dandy and just cut in at that angle up to the line that you have marked. So, and the same on this other side. And then take the scissors and continue the cut. It's a little difficult. I'm finding it here in this rather bright light of the TV studio to identify the fine cut line and to keep the thing so that you can also see it satisfactorily. I think you'll find it a little easier to do where you can adjust the lighting more to your particular technique. Now, you will not get a precise cutting of the backing using the shears, and it's necessary to take either a carborundum stone or a Joe Dandy disc and complete the contouring with that. The backing has been slipped onto the porcelain facing here, and I think you can see that we've got a reasonable adaptation, with that exception of that one area perhaps where the keyway there is still projecting out, and that has to be adjusted. And a fairly easy way of doing that is with a heatless stone, and if this is done carefully, you can do it with the backing in position on the porcelain, so that you've got a good guide at the point at which to stop. So with a heatless stone, gently trim back that keyway area that is projecting out there. Taking care not to touch the porcelain or change the contour of that area. The heatless stone can also be used to go around the periphery in any areas where it's not completely adapted, perhaps in the areas of those bevels where it's not cut back far enough. You can, using the edge of a nice new stone, you can make slight adjustments to the overlapping metal edge here, just to cut it back so it is just level with the occlusal table of the porcelain pontic. All of this area is going to be covered by wax and, of course, ultimately by gold. So that now we have our occlusal table adapted on this situation. The relationship which we've established between the gold backing and the porcelain at the present time is shown on this side of this diagram here. Now, if we were to leave that type of relationship and then wax up the occlusal surface here, invest and then cast, in the finished pontic we would have cast gold here with a thin rim of the backing exposed in this area here. To avoid that, it's customary to put a 45-degree bevel along the boundary of the backing all the way around, so that when we wax up, the wax comes right down to this point here, and when it's cast in gold, of course, the one quality of gold comes all the way down, and this is completely covered and protected. so that this 45-degree bevel is placed all around the periphery of the backing, as you see here. In this particular situation, you'll remember that we had put a bevel here on the porcelain itself, and our backing is sort of set back in this position. We bevel this to follow on and match from the bevel on the porcelain, so that in the finished Pontic, in our case, we'll have this gold extending down into that region, being covered by the wax and the cast gold. The backing is removed from facing, and with a suitable carborundum stone, the 45-degree bevel is established around the periphery of the backing. Backing is returned to the facing and checked all the way around. The next step is to orient the facing in position prior to waxing up the occlusal surface. And it's a good step, good point at which to try the facing back onto the original model and check the adaptation to the mucosal area, check the vertical length, check the opening of the embrasures here, and make sure that there's adequate space on the occlusal surface in here for the wax up of the occlusal surface in there, and also that the relationship to the adjacent teeth, so far as connectors are concerned, to the retainer on that tooth and the one on this. We made special provision for that here by those bevels, allowing the gold to extend down into proximally in the region of the contact in those situations. Now, the facing should be very precisely placed now in exactly the position in which it's required, and it's probably best to do this on the original model rather than the duplicate model on which most of the procedures have been done up to this point. So you've got to get the relationship on the buckle correct, you've got to get it correctly aligned in the Pontic space so that the mesial and distal embrasures are in the relationship that you want them, that the long axis of the tooth is just exactly where you want, and that it's positioned so that you've got an equal space on either side in the contact areas. You don't want it right up against one tooth and a wide open space on the other. You want to distribute that space nicely between the two sides of the Pontic in that area, and check it very carefully from all directions and angles to make sure that you've got it in exactly the position that you want. And then when you've found that position, we're going to make a plaster template to go on this side, which will hold this in position whilst the occlusal is waxed up, so that we can develop the occlusal surface in relation to the opposing teeth and maintain that. So our next step then is to make a plaster template for this situation. Some separating medium is necessary here, and in this particular situation the cleanest and the best one to use is just a little ordinary household soap and water on an inlay brush, and just paint this over the adjacent teeth and the mucosal area around there and the Pontic itself, so that the plaster core will not stick to that. You can use other materials for this, but this will be the cleanest and the neatest one to utilize. So now we're going to mix a little impression plaster, and with the impression plaster make a small core to locate that Pontic in the position which we've selected as being the best one for the particular situation. I think this is probably the best way of getting the plaster into the water. We use impression plaster because it sets quickly and saves time, and you can shape the plaster core just as you want it. Just mix is a little stiffer than I would normally utilize. I think our temperature here is perhaps a little higher than what one usually works with, but it will do the job quite nicely. Wants to go onto at least one tooth on either side, and preferably two, and down onto the mucosal areas you can see. Moisten the finger. The plaster's in this stage, you can just adapt it to wherever you want. Notice that it stops short of the occlusal boundary of this pontic here. You want to be able to get at that to wax it. You're going to do the occlusal waxing with this template in position, so you don't carry it up over that boundary. If you do, of course, you can always trim it back later on when the plaster has set. Now, we probably better put that on one side and allow this to set. Will give us just a little break before we go back and pick this up and see what sort of core we've produced. The impression plaster is now set, and the core is ready to remove from the model, which is usually easily accomplished if a good job has been made of the waxing procedure. It's convenient sometimes at this stage just to trim the occlusal surface of this and level it off, just to give a sharp line of junction between the tooth and the plaster. Now, this is going to hold the tooth in position whilst the occlusal surface is waxed up, and it's generally necessary just to tack the plaster core in position, preferably with a little sticky wax to hold it in position on here whilst the occlusal waxing is done. Similarly, the tooth itself, or the facing, can be just tagged in here with a little wax. And then the wax on the lingual can be removed. So this will hold the tooth and the backing in position whilst the wax up is done. And any suitable waxing technique can be utilized in this particular situation in the handheld model. It doesn't lend itself to any very complicated waxing procedure. Tooth has come loose, so I'll just have to re-tag it on the labial surface with a little more wax. I think we've got it this time. Now we continue a routine wax up now of the occlusal surface. Now, normally in doing the test bridge, you would this time probably have the castings made for the bicuspid, the three-quarter crown on the bicuspid, and you would have the pin ledge or three-quarter crown on the cuspid tooth, and you may possibly have cut soldering lugs into those, so that as you're waxing up this surface, you would extend over into the cuts on those retainers into which you are planning to establish the soldering lugs. Now, wax has to extend beyond the occlusal surface down into those interproximal bevels which we had cut on there. And it extends over onto the lingual to cover over the keyway in that bevel that we made going around the lingual surface. The waxing of the occlusal surface is now being completed, and I think you can see, looking from the lingual as you have it on the screen, how it comes out into proximal and runs down, covers over the keyway, then sweeps up again into the other embrasure there. You can see the development of the occlusal embrasures on the mesial and distal with the correct marginal ridge relationship. And if I turn this around, you can see on the labial surface here the occlusal protection of gold just going over the labial surface there. We have, of course, taken the opposing model and held it in position and checked the relationship as we did before in developing space down between the teeth on the labial there. And in a clinical case, of course, where it was mounted on an articulator, you would check this too in lateral excursions, which we cannot do in this particular situation. So we now have the Pontic waxed up, and it remains only to remove it from the model here and to sprue it and then remove the facing. To sprue it, remember that we're going to have to pull this off in the direction of that keyway, so it has to pull off in this direction. So we'll put a hollow sprue onto the cingulum area of the wax there to remove the backing from the facing. Just allow the wax to harden. And then, in order to get a good grip on the porcelain, we'll take a piece of sticky wax, or stick of sticky wax, just soften the end. When the sticky wax is hardened, the facing is gently pulled forward off the backing. You can now see the metal backing underneath with the wax occlusal on the surface. Metal backing, and then the wax occlusal. You can see too, I think, looking on the underside, the bevels that extend down on the proximal there to give good contact relations. This is mounted in a crucible former. Is invested and cast in the usual manner using a hard crown and bridge gold. To summarize the main steps in the procedure then, we started off by adjusting the vertical length of the Pontic facing, at the same time adapting it to the mucosa and creating sufficient room on the occlusal to get approximately 1.5 millimeters of wax and ultimately of gold in that situation. Once the vertical length had been satisfactorily established, the next step is to develop the proximal embrasures by reducing the width of the Pontic facing in the cervical 2/3 and to open up the proximal embrasures. Once this is done, the lingual surface receives attention and the ridge-lap relationship is developed by rounding off and finishing the lingual half of that ridge-lap relationship. Following this, the porcelain was polished and the metal backing adapted to the porcelain prior to establishing the position of the Pontic on the model, following which the waxing of the occlusal was completed and the wax pattern removed, sprued, and prepared for investing.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.